Hello, hello. Good morning, good morning. Whew. All right, so let me get this kind of adjusted. I don't want the light to be shining bright all in your eyes up here at the corner. Good morning, good morning. Yes, here I am again, back relaxing. Look, so I wanted to come on here today. You guys have given some amazing topics. So like I said, we're going to go through these topics. We're going to talk about it. We're going to discuss it. Hey, Lydia, you guys can ask questions along the way. If I miss your question, what's up, Bestie Boo? Hey, Donald. So if I miss your question, repeat it to me in the comments. Because I don't want to miss questions. Hey, TT. So last week we talked about stigma and mental health. So what I wanted to talk about today, someone asked a question about undetectable, and then it also gave me and someone also wanted to know about PrEP. So we're going to talk about PrEP and PEP today. PrEP is pre-exposure prophylaxis, and PEP is post-exposure prophylaxis. So we're going to talk about those today. And we're also going to talk about what it means when we say undetectable. So we're going to talk about undetectable. So the question that someone asked was, if someone is undetectable, can the virus still be passed on? So that was the question that was asked in the post. So I'm going to answer that question as well as go into detail with you guys on that and PrEP and PEP. So let's get started. Hope you guys are having a wonderful, wonderful. Matter of fact, I give it a couple minutes. And we'll just start right at noon. So I'll give it a couple minutes. Again, if you think of some questions you want me to answer, hey Pradia, some questions you want me to answer as we go along. Hey April, please don't hesitate to ask those questions. I'm trying to see where my little thing is at. If I start yawning, y'all, forgive me. I've been up since 6 a.m. And, quite frankly, I'm still sleepy. So, yeah, I am. Hey, Yvette. Good morning, you guys. So make sure you're sharing this video. I'm also going to download this video and add it to YouTube as well. For those who like YouTube, even if you're already watching this live with me, I would love for you guys to go and subscribe to me on YouTube. That would be so awesome if you do that. Thank you. And my YouTube link, let me see. I could post my YouTube link while I'm doing that. Let me find it because hold on. Let me stop that before they mess around and be like, ma'am, your YouTube is you playing music and we don't want you playing music. Y'all know how this doggone Facebook be acting. Facebook just be on its own little funky thing. Stop. Shoot. Every time I refresh, it does that. Oh my goodness. Let me see. Where's my link? Hey, you shared. Thank you. I know TT follow me everywhere. Look, be like TT. Y'all gotta be like TT. TT says she follows me everywhere. Yes. Hold up. I'm coming. Let me mute my laptop. That way, when I do go to Facebook, it don't give any feedback and y'all don't hear me talking to myself in the background. All right, let's see. Let me go to my page. All right, so it is 12 o'clock on the dot. I almost start singing the Usher song. Anytime you say on the dot, a clock on the dot, you be wanting to sing Usher. I know it. I definitely be wanting to sing Usher. Subscribe to my YouTube channel. Yes, let me post this. Subscribe to my YouTube channel. paste. Boom. And I'm going to pin it in, as soon as it pop up over here, I'm going to pin it. Would love for you guys to subscribe to my YouTube channel. Pin comment. There, it's pinned. All right, so let's talk about PrEP. So PrEP is pre-exposure prophylaxis, okay? And PrEP is a medication that people who are potentially at risk for contracting the HIV virus, it's a medication that they take. This medication is to be taken to prevent you from getting HIV from having sex, or if you're a person who does intravenous drug use. This medication can greatly lower the risk of you contracting the HIV virus. It has been proven to be highly effective. And what I'm going to do now is I'm just going to talk about it and answer some questions that a lot of people typically have about this medication. So, again, PrEP is pre-exposure prophylaxis. What are our medications of PrEP? So, right now, there are 2 medications for PrEP. We have Truvada and Descovy. Truvada is a medication that is for all people who are at risk through sex or drug usage. And Descovy is for all people at risk through having sex, except for people assigned female at birth. So if you were naturally born a woman, you would not get Descovy prescribed to you as PrEP, because that medicine has not shown to be effective or be good for women to take. So most times the PrEP medication that everyone is going to hear about and be able to get prescribed is Truvada. And Descovy is mainly right now for men. Thank you for subscribing, Yvette. Thank you. All right, so PrEP is safe. Now, I want to say this. It is safe, but just like any medication, you can definitely experience side effects of this medication. You know, things, you know that commercial, when commercials come on TV, you know, this medicine can cause, So look, this medicine can cause diarrhea, nausea, headache, fatigue, stomach pains. You know, hey, I'll be the commercial today. And these are not necessarily long-term side effects. These side effects will go away. You know, over time, they'll just fade out. You want to, sorry, I told y'all I'm going to be yarning some. So if I make you yarn, you're welcome. You want to make sure if you start taking PrEP that you talk to your doctor, discuss any potential side effects that you're experiencing from taking PrEP medication. Okay. When starting PrEP. So first off, before anyone is prescribed either one of these PrEP medications, you must take and have a negative HIV test. Okay? You must take and you must have a negative HIV test for PrEP. While taking PrEP, you are going to have to visit the doctor every 3 months for follow-up visits, to get tested, and for your prescription refills, because you're only going to get a refill for a certain amount of time. And in order to get your next refill, you have to show up to your appointment. And this is because they want to check your labs. They want to make sure that you're not having issues with your organ functions while taking these medications. Now, another question. Can I start PrEP or continue taking PrEP without in-person visits to a provider? You can. Of course, you know now with COVID, there are a lot of telemedicine visits, so virtual doctor's appointments. It's possible, you know, you can do mail-in self-testing. You can go to LabCorp, different places, and have labs done, and they can just be sent to your doctor, things like that. If anyone starts taking PrEP and you just decide to stop it, your risk of getting HIV is going to change. You don't want to, you don't want to take it as prescribed and then all of a sudden forget to take it and start missing lots of dosages. Again, side effects. If you're having side effects while taking the PrEP medication, talk to your doctor. And blood tests are definitely going to show how your body is reacting to the medicine. So that is something to also know when you're talking about PrEP. So let's talk about the effectiveness of this drug. Let's get into the details of that. So again, we have Truvada and we have Descovy. PrEP reduces the risk of getting HIV from sex by about 99% when taken as prescribed. Did you hear that? So there is literally only a 1% chance that while taking this PrEP medication, you could potentially contract the virus. So 99%, that's on top of the almost 96% that you get from using condoms. So add that to the 99% and you almost have basically full coverage of your body when it comes to potentially contracting the HIV virus. There is still a little information about the effectiveness of how PrEP is among people who use injection drugs. But it is known that at least by 74% that the risk is lowered. It's 74% when taken as prescribed if it's someone who is an intravenous drug user. How long do you have to take PrEP before it is highly effective? This is a good question because some people think, oh, I got this pill, let me pop it, I can go have sex today. Don't work like this. This ain't no like pill that's just you finna put in your mouth and it's finna be like, yes, we own it, pop it. No. PrEP reaches its maximum effectiveness about 7 days of daily usage. So by taking it 7 consecutive days, you are going to reach the maximum protection level. Now, and this is for receptive anal sex, okay? Y'all know I don't cut words, I don't have words. We say the words around here, anal. So basically, if someone is, a bottom and they're receiving anal sex, 7 days of daily use of the PrEP. And then if it's someone, so basically women or anyone that's just only engaging in vaginal sex, or intravenous drug usage, the maximum protection is about 21 days. So almost 3 weeks before you fully get that maximum protection when you're having just receptive vaginal sex, intravenous drug usage, about 7 days if you are a bottom, and then there has not been enough data available to know the effectiveness if you are considered what they call a top when having sex, okay? And again, some of this terminology will not be for everyone. Those who understand it will know what I'm talking about. So I just wanted to put that out there because I am not proficient in LGBTQIA and any other letter that come with that knowledge. Just want to put that out there. So a lot of people also have this question, well, how do I pay for PrEP? Is this something my insurance covers? Do I have to pay for it out of pocket? What do I do? Now, most insurance plans and state Medicaid plans cover PrEP. There are also other programs that provide PrEP for free or at a reduced cost. There's a program called Ready Set PrEP, which as long as you qualify, you can get access to the PrEP medication at no cost. There are copay assistance programs that help lower the cost of PrEP medication, and income is not going to determine whether or not you get access to the program and the medication. And then some states do have PrEP assistance programs where some of the medication is covered, some clinical visits, lab costs, and or both are covered under these plans. And you can get this information off of cdc.gov. Just go to cdc.gov, put in PrEP or or HIV, and you'll be able to find this information. So that is basically that's really what PrEP is. It is a medication that can be taken if you are in that category of being put at risk for potentially contracting the HIV virus. So say, for example, your partner, someone you meet, you're dating them or whatever, have a relationship, they're HIV positive and you're negative. This is medication that you can take if you all are going to engage in sexual activity that is going to greatly, like we said, 99% effective rate of lowering your risk of contracting the HIV virus if you guys engage in any sexual activity, condom usage or not. All right. Now let's talk about PEP. PEP is post-exposure prophylaxis. What does that mean? What you talking about, girl? So post-exposure prophylaxis means taking medication to prevent HIV after possible exposure. PEP should be used only in emergency situations, okay? And must be started within 72 hours of that potential exposure. So this right here comes to play when you have work accidents. So say you're a phlebotomist or you're a doctor, you're dealing with needles, you're dealing with possibly patients that are HIV positive. PEP is going to be that step that happens. Say you get stuck by a needle, or you're exposed directly to someone's blood with your blood, things like that. So this is something that is done right away. You want to talk to either your healthcare provider or go to an emergency room, urgent care, and ask them about PEP. Let them know, hey, I was just exposed, the condom broke, I got stuck by a needle, or even if you're sexually assaulted. This is something also that is done when people are sexually assaulted. PEP for emergency situations is given, again, after that possible exposure. It is not a substitute for regular use of other HIV prevention, like condoms, PrEP, things like that. It's not for regular use. PEP is not the right choice for people who may be exposed frequently. So if you're always putting yourself at risk for potentially contracting HIV virus, PEP is not for you. Okay? And if you're at an ongoing risk for HIV, such as repeated exposure, like I just said, then that's when you want to talk to your healthcare provider about other things like PrEP and getting on that. How well does PrEP work? So if taken within 72 hours after possible exposure, PrEP is highly effective in preventing the HIV virus. But to be safe, you should take other actions. Let your partner know, whether it's a spouse, boyfriend, girlfriend, whoever it is, you want to let them know, hey, this accident happened. I got to do these precautions. And that's going to include using condoms. If you marry and you get exposed, if at some point within that time frame window, you and your partner want to have sex, you still need to use a condom because you want to make sure that you're not affecting that window time of making sure that you did not get infected with the virus. So yeah, does PEP have side effects? And of course, with all medications, you're going to experience some side effects with PEP. What happens with PEP is, you're going to have blood work done. They're going to make sure first that the PEP medications that they use are not something that you already have a resistance to based on other type of medications. So that is something that's going to be done. You're going to be given this medication. And definitely if you are in the workplace and something happens like you potentially being exposed, you want to make sure that this is like that first step that you're going to want to take is going to the emergency room, doctor office, say, hey, I was potentially exposed, I was stuck by a needle, whatever it is, and you want to let them know, hey, I want to have PEP medication. I have a really, really close friend. This happened to her, I believe, may have been a couple years ago. She was working at a dialysis clinic, and one of her patients who actually was HIV positive, and they were doing it in the, dialysis clinic, you're using needles, and the needle came out, it stuck her, and immediately she had to go to the emergency room, and they put her on these medications. They put her on PEP medication. She had to take it the time frame they told her she had to take it, and she had to get tested to understand that, we want to make sure this medicine, not number one, is not harming you, but also that you are remaining HIV negative. So this is why PEP is very important, and why you should not be afraid to know about PEP or to even talk about it, because PEP is not just something that, if you're just out here, doing whatever, you can just be in your workplace doing your job and an accident can happen. And this is in place to be able to help you through that process. And then again, paying for PEP is just like any other medication. You might be able to qualify for partial or total reimbursement for medicines or clinic costs. Depending on the reason you're prescribed PEP, you might be able to get it for free. So there are lots of options for that. Usually, if it's a workplace exposure, your workers' compensation will pay the whatever cost. Okay. Paying for PrEP for another reason. If you can't get insurance coverage, your healthcare provider can apply for free PrEP medications through the medication assistance programs. Many manufacturing companies of these medications offer this to people. A lot of people don't know. Like, sometimes people say, oh, well, I can't afford this diabetic medication, or I can't afford this cholesterol med, whatever it is. A lot of people can't afford it. You can go directly to the manufacturer, and sometimes they have free to low cost programs that will allow you to get this medication. So this is something that's available to you. And especially by it being an urgent need, they're going to be on top of it. Sorry for yawning again. They're going to definitely be on top of it. All right, so that is the basis of PrEP and PEP, you guys. So the thing that a lot of people really are eager to talk about and discuss is undetectable. What in the heck does it mean to be undetectable? So, oh goodness. I'm over here yarning, sleepy, all kind of stuff, y'all. All right, so. So undetectable. So U equals U. You guys have probably been seeing commercials about this. You've probably been hearing all kinds of things about undetectable. So U equals U. Undetectable means equals untransmittable. What does that actually mean? That means that people with HIV who achieve and maintain an undetectable viral load, which is the amount of HIV in the blood, by taking their medications daily as prescribed, cannot sexually transmit the virus to others. Let me say that again. Let me read it again. U equals U means that people living with HIV who achieve and maintain an undetectable viral load. Viral load means the amount of blood of HIV in the blood. Means you have less than 20 copies in 1 milliliter drop of blood. There's less than 20 copies of the HIV virus. That means you're undetectable. And you achieve this by taking your antiretroviral medications, your HIV medications, daily as prescribed. You cannot sexually transmit the virus to others. Okay? That is what U equals U means. So there have been many trials that have been done, many clinical trials, and some that were not done in a short span. There's been a 10-year trial of heterosexual couples. There have been trials with male-to-male couples. There have been trials with different mixed status couples. All right, so through these many trials, it has been proven that as long as you're undetectable, you cannot transmit the virus. So the question that someone asked was, if someone is undetectable, can the virus still be passed on? And the answer to that is no. Now, how do we know for sure that the person that we're engaging in sexual activity, that they're telling me they're undetectable? How do we know that for sure? This is when you have that discussion. This is when you know for sure not only your status, but your partner's status. If in fact your partner is HIV positive, what you want to do is make sure that they are staying up to date with going to the doctor, with taking their medications, knowing what their labs are. They want to know that their lab is saying that they're undetectable. And if this is a person that you are in a serious relationship with, I will hope, and I would also encourage that you not only know this information, see it with your own eyes, but also be a part of their doctor. Like, say, hey, I'm okay going with you to the doctor. Be involved. Show them that you care about this and you understand and you want to know this information, because number one, them being undetectable and you being negative is what is going to keep you negative in this relationship. If you're in what's called a serodiscordant relationship, that means one partner is negative and the other partner is HIV positive. So this is something that you want to know, this information. Now, you can get this information when it comes to the case studies that were done, the information about U equals U. You can get this information by looking at the National Institute of Allergy and Infectious Diseases website, the NIH, the NIAID, I'm sorry, the NIAID.nih.gov. This is a national website. It gives you, not only does it give you this information about U equals U, it's going to give you other information regarding any type of infectious disease, because remember, HIV is not the only infectious disease out here. There are many other diseases and conditions out here other than HIV that is infectious. You have things like malaria, influenza, hell, what we got? Coronavirus, Corona May. We got Corona May out here just going around floating in the air and stuff. You have certain food allergies, tuberculosis, Ebola. Like, there's so many other infectious diseases and conditions out here. But this website will also give you that information in regards to what the U equal U is and how you can look at those case studies. So you want to make sure your partner is what's called virally suppressed. Being virally suppressed means that your medication is keeping your HIV virus from making copies of itself. It's keeping your body in that undetectable status by putting that HIV virus at bay, saying, listen, I know you in there, but stop what you're doing. Put a hold on it. I'm not going to let you do nothing else because I'm here now. This is what the medication is doing. The medication enters your body and it lets this virus know that, hey, I'm here. You just got to stop what you're doing, okay? I'm just saying that, like, that's really the easiest way to explain what the medication is doing once it enters your body to help you maintain that undetectable status. All right, you guys. So for those of you who are watching, whether you're watching it live on a replay, if you have any questions while I'm still on here, please feel free to ask. I will answer those questions. I'm still trying to see what I want to talk about for our next discussion. I'm thinking I want to kind of flip it a little bit and get into some testing questions. I know I had a couple questions of people asking about getting non-reactive test results, and how do people, why are people having unprotected sex without getting tested? So I think that might be my next topic. We may talk about that on tomorrow. I might put that in there for tomorrow at noon, and have that discussion. But yeah, so if anybody has questions, also I got my my most recent Positively Awareness magazine. So I'm also going to be going through this magazine, because this magazine, I used to get like big bundles of these, and when I did events I would have them for people to take and look at, but now I just get them just for me. So this is the May and June issue. This is going to be a really good issue for me to read and give you guys some information, because this is going to be talking, there's an article in here that talks about sex, love, and dating. Sex, love, dating, and HIV after 60. So, yeah, there is someone in here that is talking about being 60 and plus and sex, love, and dating. Also, there's an article in here talking about when HIV therapy fails, because guess what? When you are HIV positive and you fail to take your HIV regimens the way you need to, you are putting yourself at risk for being resistant to the medications. So there are people in this world who are HIV positive and who are not able to take any of the current HIV medications because they have built a resistance, and that is due to non-compliance. So we are definitely going to be discussing some of the things that I am going to be finding in this book. I'm excited to get to reading that. So if there are no questions, thank you guys for tuning in. Again, I'm going to be saving this and I'm going to be putting it on YouTube as well. Make sure you click that link and subscribe to my YouTube channel. I will be doing some YouTube stuff as well, so not necessarily always on here. I'm going to be doing some stuff on YouTube also. And that's it for today. That is it. Now I get to have a little break. I had a good breakfast this morning. I might get a small little lunch or a little something quick. But other than that, that's it, you guys. Thank you for tuning in. Have a wonderful, wonderful Monday. Have a wonderful week. And I will talk to you guys tomorrow. Bye.